One of the things hanging over this election is this Ebola outbreak. Is the government following the right policies here?
I think the president's biggest mistake was like saying, oh, it's no big deal. You can't catch it if you're sitting on a bus with somebody. Well, apparently you can be in the intensive care unit, gloved, gowned, and masked and still get it. It's very contagious when someone's sick. So I think it was a mistake for him to say, oh, it's no big deal. You could be riding on a bus and we're not going to stop any travel. American public sees people getting it who are fully masked and gowned and saying, my goodness, I don't think anybody should be riding on a bus or coming from Liberia to visit their aunt or uncle and when they could be contagious. So I think a temporary stop of travel for elective travel, if you're coming to visit your relatives, couldn't that wait for a few months?
You know, you're a doctor. Samantha Power, who was the UN, is the UN ambassador, will be talking to us later in the broadcast. She is just back. She went to all three of those countries. You're a doctor. Would you feel safe going to one of those countries to administer to those
You know, the Doctors Without Borders and the nurses are doing it, I think, are real heroes because they do take a risk. So I think if someone said, oh, I'm going to be perfectly safe, they wouldn't be being honest. But I have a great deal of admiration for these doctors because I think they do take their life in their own hands and they are doing something at their own peril. So I think we have to, it's almost the same way we treat people who do a service for our country in the military. People who would do that kind of service in the medical profession deserve a great deal of respect and admiration.
Do you think we ought to tighten the restrictions on who can come to this country? Canada has just said citizens from those countries can't come into Canada.
The interesting thing is, I think from the beginning of our country, we always had restrictions on infectious disease. In fact, that was one of the primary things we did at our border was to stop. We have, in most recent years, stopped drug-resistant tuberculosis patients from coming into this country. When we had polio, we had restrictions on things with polio. So I don't think it's out of the ordinary for government to be involved in this. And what I'm looking at is not a stopping of sending humanitarian aid to them or workers to them. What I'm saying is elective travel, commercial travel for people who just want to visit the United States. That really isn't a necessity, and we could wait a few months on it and would make our problem a lot less if we were only thinking about healthcare workers coming back. But then they need a consistent program for that, and they need to not be. I think it was unsettling to a lot of us when they blamed the nurse for getting Ebola. I mean, I'm in the medical profession, so I would never blame a nurse for getting an infectious disease. And I've had friends who've had needle sticks taking care of AIDS patients, so I understand what it's like to have accidents happen all the time, even when you're trying to do the best you can.